This is lateral part and this is medial part of the forearm. How to identify? This is thumb side which is lateral and this is little finger side which is medial. Thumb is thenar eminence and little finger is hypothenar eminence. So here you have certain muscles. What are those? This muscle is brachioradialis. Brachioradialis is a muscle which is moving towards the posterior compartment, that is extensor compartment of forearm. When you have studied cubital fossa, we came across this name of this muscle. This is pronator teres. We have flexor carpi radialis. We have flexor palmaris longus, then flexor carpi ulnaris and flexor digitorum superficialis. All these are the muscles what we see in the superficial compartment. Now, if you observe, we have seen like in the cubital fossa, we have used one code like MBBR. What was that? Median nerve, brachial artery, bicipital aponeurosis, and like biceps brachiae tendon, and superficial branch of radial nerve. So that means brachial artery is actually bifurcating at the level of head of the radius. Now it is dividing into radial artery. So the radial artery you can see here, the radial artery is running just below the brachioradialis and then it is seen like in front of the forearm, like 3 to 4 centimeters above the wrist joint. So this is flexor retinaculum and we see like this radial artery goes deep to the flexor retinaculum to enter into the palm. So in the palm it takes part in the formation of superficial and deep palmar arches. Okay, so first you have seen the flexor compartment. Once you remove these pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis and flexor carpi ulnaris, we will see underlying muscles. So pronator teres is cut. What are those? We are finding flexor digitorum profundus and flexor pollicis longus muscles we will see. And connecting the radius and ulnar bone, we have the radio-ulnar joint, and this is the interosseous membrane, and this is inferior radio-ulnar joint. That is also one of the question today we will take after this topic. Okay, now origin insertions you can study better. One by one you check what are the muscles we have. Pronator teres we have, then we have flexor carpi radialis, palmaris longus which expands in the palm to form palmar aponeurosis. Okay, so this is the palmar aponeurosis. So we are, after this we have towards the ulnar side we have flexor carpi ulnaris. Within the flexor carpi ulnaris we have one sesamoid bone. The name of the sesamoid bone is pisiform. Okay, then this is flexor carpi ulnaris and pisiform is actually formed in the tendon of flexor carpi ulnaris. Okay, then what are the other muscles? We have flexor digitorum superficialis. Okay, if you cut this muscle, so flexor digitorum superficialis will have 4 slips which will go and split in the middle phalanx and they get inserted on the either side of the middle phalanx. This green in color actually is the flexor digitorum superficialis. The tendons are going deep to flexor retinaculum. Okay, so this is our flexor digitorum superficialis. If we cut flexor digitorum superficialis, in deeper plane we have flexor digitorum profundus, flexor pollicis longus. All these muscles are lying one below the other. Niharika, they are present in 3 layers beta. Pronator teres, that slide was first row. Okay, flexor digitorum superficialis is second row, and in the third row, that means in 3 layers, the last row we have flexor digitorum profundus and flexor pollicis longus. If you cut these muscles also, you have wristband type of muscle, that is pronator quadratus. So you are supposed to memorize the names of muscles. Basically, I don't think you will be asked like origin, insertion, nerve supply, action of these so many muscles, hopefully. Okay, basically these are actually important in viva where limbs will be kept. Okay, so pronator quadratus is, once you remove all the muscles you will see pronator quadratus, wristband type of muscle this is. Okay, so now all muscles are put in one plane. Now see here, this is, we are seeing this is brachioradialis, we are finding this is palmaris longus, and then this is flexor carpi ulnaris because we have pisiform bone. In the second layer, this is flexor carpi radialis, palmaris longus, flexor carpi ulnaris. Second row, flexor, if you cut these muscles, you will see flexor digitorum superficialis. If you cut this muscle, you will see flexor digitorum profundus, flexor pollicis longus. If you cut these muscles also, you will see pronator quadratus. So in a simple tabular form in your textbooks, all these muscles, origin, insertion, nerve supply, action are given. Just go through once. Okay. Once you are done with this, so we know basically in the front of the arm we have brachial artery. So the brachial artery at the neck of the radius, it will divide into two. What are the two terminal bifurcations? On the radial side we have radius bone, that is towards the thumb we have radius bone, no? So here we have radial artery, and towards little finger we have ulnar artery. Okay. You have to remember all muscles beta if it is coming as an essay. And if it is for practicals, if you just name them also, examiner will consider. You need not worry. But suppose if our luck is not good, and if the details of like serratus anterior was asked and pectoral muscles were asked, very rare questions, then it's better if you have time, better you memorize all the origin insertion of all muscles. Okay. So 99.9% not required from my side. But suppose if you feel like why to take the risk, you can go ahead better. Okay. So now coming to the blood vessels, see this is our brachial artery. So brachial artery, it is actually dividing into radial and ulnar artery. Okay. So now radial artery, if you remember, we have studied anastomosis around elbow joint. So it is giving one artery which is going behind, that is radial recurrent artery. Okay. So one branch is actually going like right in front of the interosseous membrane, you call it as superficial radial, and one goes behind the interosseous membrane, you call it as deep radial. So brachial artery divides into radial and ulnar arteries. Ulnar arteries, here we have seen this when we were doing anastomosis around elbow joint. We have anterior ulnar recurrent, posterior ulnar recurrent. Okay. Then we have common interosseous. This common interosseous actually gives, see this is the common interosseous which is clearly shown here. Number is given 8. This common interosseous is giving one branch which is going behind. So that is posterior interosseous artery. Okay. So this in front is the anterior interosseous artery. Okay. So these, see if you just ignore the other two branches, if you observe, from the radial artery and ulnar artery, you have a network formed in the palm, okay, which is actually called as superficial palmar arch and deep palmar arch. These arches also may come as short notes. We will study those arches also better. Okay, we need not do nerves for now. So, but like to understand arteries course, you need to know the names of muscles, right? See, this is our brachial artery, and this is thumb side. Obviously, this is radial artery. It is running below brachioradialis in all its course. Above flexor retinaculum, it is seen in front of the forearm. Okay, it gives, it goes deep to the flexor retinaculum, enters into the palm, forming superficial and deep palmar arches. Okay. So this is the like theory part of the artery which you are supposed to write. Similarly for ulnar artery also, you talk about anterior and posterior ulnar recurrent, common interosseous, anterior and posterior interosseous, muscular branches. It is going below flexor carpi ulnaris muscle, then it goes deep to the flexor retinaculum. Again, this also takes part in the formation of superficial and deep palmar arches. So towards little finger, this artery is ulnar artery. Towards thumb, this artery is radial artery. So any artery can be asked with a given reading. So if you have the information of muscles, you will be able to understand the course of artery. Okay. So Volkmann's ischemic contracture is a condition. Suppose if there is any blockage of the artery, then you will see that muscles will not receive proper blood supply. Okay, that will lead to a condition called as Volkmann's ischemic contracture. It will be like this. Okay. So that is, so let me take you to the radioulnar joints as next answer. Meanwhile, try to read radial artery now itself from your textbook, so that you will come to know the course of it, how it is related and all, the branches and all also you will understand. Okay. So meanwhile, I'll open radioulnar joint. So this superior radioulnar joint, this is inferior radioulnar joint. So superior radioulnar joint, you are finding this is the head of the radius. Okay, and you are finding it is fixing into the like radial notch of the ulna bone. So this type of like fixing of the head into the notch, you call it as pivot type of joint. So in order to, so whenever head is fixed in the radial notch, there is a ligament from outside which is covering surrounding completely. You call this looks like a ring what we wear in our fingers. So this is called as annular ligament. Okay, annular ligament. So correspondingly, if you see on the inferior aspect, I said we have head of the ulna. So this small projection is head of the ulna, and then here you will have like ulnar notch in the radius bone, and there will be a communication here. You call it as inferior radio ulnar joint. And connecting the radius and ulna in between, you have interosseous membrane, which is called as middle radio ulnar joint. Okay, so with this small information, now you will understand what is given in our textbook also. Now in our textbook, what is given now, see here. So are you finding the table now? Yes. So superior radio ulnar joint is pivot type of joint. Even inferior is also pivot. So how is it formed? Head of the radius, which is fixing in the radial notch of ulna. There you have a ring-like ligament. You call it as annular ligament. Here head of the ulna is actually fixing in ulnar notch of radius. Okay, now what are the various ligaments we find here? One is annular ligament, which is the most important for this joint. So it is actually forming 4/5 of the ring in which head of the radius rotates. Okay, that point is enough. Apart from that, there is one more ligament called as quadrate ligament, which is extending from the neck of the radius to the lower margin of ulna. That much you remember. And anastomosis, blood supply, we have already studied. So for superior radio ulnar joint, it is anastomosis around elbow joint on the lateral side. Okay, then nerve supply, front of the arm, we have musculocutaneous nerve, and in the cubital fossa we have median and radial nerve. So all these nerves are giving nerve supply to superior radio ulnar joint. Movements are, this is supination when you beg something, this is pronation. So supination and pronation are brought about by these joints. Similarly, like any other joint, like even in inferior radio ulnar joint, outside thing we have is capsule. Okay, then there is a triangular fibrocartilaginous disc. You just name it, triangular fibrocartilaginous disc, which is seen on the inferior radio ulnar joint. Blood supply, anterior and posterior interosseous arteries, and nerves are also anterior posterior interosseous nerve. Anterior interosseous nerve is a branch of median nerve. Posterior interosseous nerve is a branch of ulnar nerve, and the function is supination and pronation. Okay, beta? So now there is, apart from this, there is one important topic which can come for 3 marks question, which is called as carrying angle. So let me tell you. See, carrying angle, what is this? Suppose if you see, this is the humerus bone, and here on the medial side we have ulna, and on the lateral side we have radius. But if you just keep our limb on the side of the body, it is not in straight line, but it is making some angle. So this is straight line, and the angle what it makes is 15 degrees. Okay, with the medial plane. Okay, so this angle is actually called as carrying angle. So this is 0 to 15% in males and more than 15 in females. Actually, the importance of this carrying angle, why our limb like elbow region is little away from the body, is because it allows our limb to carry heavy weights, like when we carry buckets, isn't it? Something like that. That is the function. So the transverse axis of elbow joint is directed medially and downwards. Because of this, the extended forearm is not in straight line, but it makes around 15 degrees angle, which is called as carrying angle. Okay, so that is also one of the important questions what we have here. So what are the rest of the questions? Elastic cartilage. So what do we have in elastic cartilage? How is the pharyngeal plexus of nerves formed? So pharyngeal plexus of nerves will be formed by glossopharyngeal nerve, vagus nerve, and accessory nerve. You can make a note. 9th, 10th, and 11th cranial nerves, they form a network in the pharynx, and that forms the pharyngeal plexus in the nerves. Anyhow, pharynx we will discuss as essay question one day better. nasopharynx, oropharynx, laryngopharynx. We will see these details. Cleavage lines of the skin in the face are nothing but the transverse lines what we usually see under the microscope when we just observe the skin, or if we closely observe our body also, there are certain lines, okay, which are actually formed during embryological development. And the importance of these cleavage lines are, if you are planning for some surgery, if you give incision along cleavage lines, the healing will be faster and scar will be minimal. Scarring of the tissue will be minimal and healing will be faster. Okay. So motor speech area we did. Elastic cartilage I will show you. Fornix also I will show you. Fornix also we did, but still I will show you the fornix. Where did we see fornix when we were doing this corpus callosum? We did just now, right? Just below that septum pellucidum, we have seen that fornix. Fornix is actually a part of limbic system, what we will study in physiology. See here. See, like this limbic system parts are many, which are given like different colors. Okay, overall you are finding there is one curved structure which is seen associated with this. What is this area? You call it as corpus callosum. So associated with corpus callosum, we have a white matter tissue only, which is called as fornix. Now let us see fornix separately. So we should know the parts of fornix. So I'll try to share the same picture what I have shared previously so that you will recollect fast. I have shared, yeah, this picture from Netter's Atlas. Yeah. So this is one of the white matter fiber what we see just below the corpus callosum. See, in order to get orientation, let us make use of this picture. We know this is corpus callosum which is shown in pink color. Just below corpus callosum, I told you there will be a curtain, that is septum pellucidum. If you cut septum pellucidum, we will enter into lateral ventricle. Inferior to septum pellucidum, you are finding one white matter tissue, which is shown in red color. That is the position of fornix. Once you know the position of fornix, that means these are mammillary bodies, these are anterior columns or horns, this is body of fornix, this area is hippocampus, this area is fimbriae. So all this is actually, these are the various parts of the fornix what we see as a part of white matter. Okay, so we better draw this picture and give the labelings. The components of fornix are mammillary bodies. We have two columns. This is body. We have commissural fibers connecting the two columns of the fornix at the level of body. These are the two crurae. Okay, so one crura is in continuation with hippocampus and they are in connection with amygdaloid bodies. Okay, so this is fornix. Okay, then we have elastic cartilage. Let me take you to elastic cartilage histology. Can you tell me what is present in elastic cartilage histology? We did, at least tell me examples. One of you have shared the picture also in our group previously. Okay. So when we draw elastic cartilage, so what we will do is, first thing is you will see it has outermost covering which is called as perichondrium. Okay, perichondrium. And when you just go inside, you will have matrix. Inside the matrix, we have elastin fibers which are highly branched. Okay, so why these all fibers whatever we are seeing, these are all elastin fibers. Okay, and in between whatever spaces you are finding, actually these are lacunae. Lacunae are nothing but empty spaces which are filled with chondrocytes. Chondrocytes we find inside the lacunae. The function of these chondrocytes are to produce elastic fibers which are running in various directions. Once they do the job of producing elastic fibers, they get trapped inside the empty space, that is lacunae. Okay, when they are forming the elastin fibers, you call them as chondroblasts. But once their job is done, when they are finishing the work of producing elastin fibers, they are transforming into chondrocytes, which get entrapped in empty spaces. These empty round spaces are actually lacunae, and this dot inside the lacunae is chondrocyte. So you have to talk about the covering, which is actually the layer which is giving the like chondroblasts and chondrocytes like perichondrium. Okay. So elastin fibers, where do we find elastin? External ear, you can remember. One example. E, it starts with external ear or pinna. Epiglottis, one more example we have. Okay. So two examples are enough for this elastic cartilage. Okay. So biceps brachii origin insertion almost I am telling you daily, and the remaining are embryology questions, right? Only one embryology question, that too. So we will do when we do it embryology. Okay, is that all right? So I'm leaving here and we will be meeting within short time for physiology. Okay, so I'm ending the class here now.